My name is Chris Willey, and I'm a medical doctor in radiation oncology, which means I treat cancer patients with X-ray therapy and proton therapy. My typical day is split up between seeing patients, doing procedures where I'm delivering very high-dose radiation called radiosurgery. I spend time on the computer planning radiation treatments, which involves looking at radiology images like CAT scans and MRIs. And then I spend some of my time doing research. I actually have a laboratory as well. So my day is kind of broken up among those things. We also have things called tumor boards where we get together and the surgeons and the pathologists and different medical doctors will discuss things related to each patient, and we try to come up with kind of a game plan for taking care of them. So becoming a medical doctor does take a good bit of time. You have to go to school for actually quite a bit, but each passing phase is kind of more exciting. So after finishing college, you actually apply to medical school, and so medical school is a 4-year program. In some cases, you end up doing additional work like getting a master's or getting a Ph.D, which is what I did as well for research. And basically, you complete your medical school and you're a medical doctor. But typically, if you want to actually practice a particular type of medicine, like being an orthopedic surgeon or being an emergency medical doctor or a radiation oncologist like I am, you have to go through a specialized training called residency. And so that takes time as well. It's fairly science focused. So if you like science, you like biology, you like physics, chemistry, all those things are related and can help support going to medical school. So those are kind of the major job requirements related to this field. The best thing about this job is the fact that I get to actually help a lot of patients. So my patients come in with cancer. So cancer is a deadly disease where a tumor cell basically forms and kind of wreaks havoc by going haywire and growing and spreading throughout the body. In some cases, we're able to cure their disease. In some cases, we're able to control it. And so a lot of my enjoyment day to day comes from, caring for these patients and helping them. Kind of the worst part is when something bad happens to your patient, obviously. And so if my treatments don't work or the other therapies don't work, it's obviously pretty much a downer. The job of being a medical doctor does come with some perks. I mean, you're usually fairly well respected in your community, and you can be proud of going through the long training, I guess, and so you're usually compensated fairly well. That means you actually get paid a pretty good living, and after you're able to pay off your student loans, which takes quite a while since you're in school for a long time, it's actually pretty nice. But it's a great field, and I wouldn't really trade it for anything else. So if you're interested in becoming a physician or medical doctor, there are a few things that you probably want to do. So one is to just try to understand a little bit more about the medical field. There are a lot of things you can do in the field of medicine, not just being a doctor. There are nurses, there are therapists, there are so many supporting services that actually get to do a lot of stuff with patients and help people, which brings a lot of enjoyment. So my advice is just to kind of get in there and volunteer, kind of shadow a practice, meaning you go there and kind of watch what they're doing, just kind of like a shadow in the corner, and just kind of see how their days go. There are many different types of doctors, so the experience you have in one type of practice, let's say a pediatrician's office, may be very different than, let's say, a brain surgeon. So it's good to kind of explore a little bit. You want to do very well in school, good grades, good test scores, particularly to get into medical school, you have to pass a test called the MCAT, which it'd be something you'd study for in college. But essentially, you want to kind of work hard and try to do your best in your classes, particularly the science classes, because those are really important for getting into this field. But like I said, it's something I really enjoy doing. I like helping people. And then with the research, I get to explore maybe new ways of treating patients in the future. So kind of that's my spiel. I hope you guys are doing okay.